Hello. I hope you're having a wonderful day. Welcome back to my little corner of the internet. Today I'll be talking about non-traditional clinical roles for PTs and OTs. So these are still clinical roles where you're working with patients, but there's some non-traditional routes, right? So these routes are gaining some popularity as more and more clinicians are looking to avoid those mill type clinics that are becoming very popular, and for clinicians who are really kind of hoping to avoid some burnout. I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for PTs in my 18-year career, and that does include clinical and non-clinical jobs. At the root of everything that I do, it is to help clinicians to avoid burnout. So I thought it'd be fun to offer you some new ideas for clinical work as a way to kind of help you avoid some of that burnout. So let's get started. So, the first traditional or non traditional clinical role is either concierge or performance PT. So, this is more of your cash based type clinic, but the focus of PT here is more on performance. So, basically, if a patient wants to pay for the service, they can get it from you. So, there's no back and forth with insurance companies, avoiding the medical necessity struggle that comes with in network physical therapy. So, you work like a concierge to the client, offering them services they want to feel better, to heal, to perform better, anything like that. So, this model allows you to be paid on outcomes and even some prevention. So, it's most often used for athletes and those high performing clients, but it allows you to treat the whole person without any constraints from insurance or clinical work or whatever, right? So this means you can spend 90 minutes with that patient if you want to. You can see them once a week for an entire year if that's what the client wants to do. You can show up simply just for a dry needling session or just a Normatec compression session for recovery. It doesn't have to be what you would imagine your normal clinical treatment session would be, right? It's whatever that client wants. So you're given the opportunity to focus on the client's longevity versus just recovery of one single injury or a diagnosis. You can keep seeing them if that is what the client wants to pay for. Okay. The next non-traditional clinical role is as a digital clinician. So this is ideal for anyone who wants to stay in the clinical realm, but they want to work from home or really work from anywhere, right? So this is commonly seen in telehealth, which can be in network or it can be out of network, but where you're providing PT or OT evaluations and treatment sessions just virtually. Okay. But it can also, and a lot of people know what telehealth is at this point, but it can also be remote therapeutic monitoring, which is kind of a newer thing. So this uses sensors and tracking of your patients during treatment sessions when you're not working with the patient. So you're given the data from the sensors to assess movement, to see what the client has been doing, to see how they've been moving, looking at their quality of movement, how often they're moving, things like that. Then, based on the data you're given, you can now adjust the patient's treatment plan, their exercise program, their goals, anything you want to adjust about their treatment plan. But all of this can be done from home or from anywhere. You can travel while you're doing this, okay? The next non traditional clinical role is occupational health or the industrial athlete. So, this setting is not in a clinic, it's at the workplace. Okay. So, you go to the client's plant or their factory or their distribution center or their manufacturing center, and you work with industrial workers. So, these workers are considered athletes simply because of the nature of their work. They're constantly lifting things, they're moving things, they're heavy things, right? And they're doing it over and over again. So you work like a strength and conditioning coach for a member of that workplace. So what happens is the company will pay you, the PT or the OT, to keep their industrial athletes or their workers safe at work. So the setting is also more about prevention and being proactive to avoiding injuries at the workplace. So it might look like teaching proper body mechanics to anyone lifting boxes or loading objects, right? It can be analyzing the ergonomics of a desk setup or the ergonomics of an assembly line. Okay. So you're teaching effective stretches or exercises to different types of workers in order to minimize their injury throughout the day. And you're teaching companies and teams how to avoid those overuse injuries This could also be done at fire stations or police forces, so anywhere that there are a large number of employees who can benefit from injury prevention. So essentially, what happens is that company hires the PT or the OT to help keep their workers safe and injury free to avoid those unnecessary surgeries or to avoid missed work because of a preventable injury. This is kind of picking up steam in the non-traditional clinical route, okay? Another non-traditional clinical role is specialized consulting. So specialized consulting is gaining a lot more traction from PTs and OTs. This is things like aging in place or consulting for home modifications. So you take your experience as the PT or the OT, you make a client's living environment more suitable for that client's needs, whether it's due to advanced age or new diagnosis, right? So, a home modification consultant could be consulting on a home remodel for a bathroom or a kitchen for a new wheelchair user, or adding safe technology to a home, or working with a contractor when they're building a house or making a modification to a house that adds appropriate ramps and entryways. Aging in place would be making adjustments or modifications to a person's home so that the client can stay at home as they age without having to go to a facility like a skilled nursing facility or an assisted living facility as they get older. So you can work as the PT, make recommendations, help make modifications so that the patient can stay at home as they get near the end of life and get older and then get to the end of life, right? Another form of specialized consulting is in canine rehab. So, this is where you're going to use your knowledge and your expertise of biomechanics and manual therapy to treat dogs or even other animals like horses or, I don't know, whatever, cats, right? So, this does require certification and a strong relationship with a veterinarian. And I mean, very strong relationship with a veterinarian to get referrals. But this is a great non traditional clinical role if you love animals. And the last non traditional clinical role for PTs and OTs is a PACE clinic. So, PACE, PACE, stands for Program of All Inclusive Care for the Elderly. It is funded by Medicare or Medicaid and provides all inclusive care by an interdisciplinary medical team that's found in all in one place. Okay. So the patient or client, they do have to qualify for the program based on a list of specific requirements, but essentially, the patient's able to remain at home. They can still live at home, but then they're brought into the PACE clinic for any necessary medical services that they might need, a PT treatment or a doctor visit or a x-ray. Okay. Um, this can include any medical service. Like I said, it can include a PT or an OT treatment session. So oftentimes there is a gym within that PACE facility for exercise needs. DME can be ordered by the PT and OT if the patient needs it. There are interdisciplinary team meetings to discuss all of the patient's needs, and even home assessments can be completed. So this type of clinic allows you to treat the older adult in a more holistic manner than a traditional outpatient clinic or a skilled nursing facility. And while it is funded by Medicare or Medicaid, the payment model is based on a flat fee per person per month. So it's not driven by how many units you bill or your product, like how many patients you see. So there's not really a lot of emphasis on productivity in a PACE clinic. The focus now in these PACE clinics, the focus shifts back onto quality outcomes, not volume of patients that you're seeing. So, as you can see, there are quite a few options that can allow you to continue to work with patients that don't involve that patient volume, documentation expectations, billing requirements, risk of burnout that can be found in your traditional clinic or even a hospital setting. Each of these set options that I mentioned may require an additional set of skills like business management or marketing or sales, may require another certification. It may require for you to learn some new platforms, new technology. But that small commitment might be worth it for a change to a more holistic, autonomous, and less demanding work environment. So ultimately, it's always important to remember that there are always other options. You don't have to stay in one place. If you don't like something, our profession always allows us the option to make a change, which is one of the really, really good things about being a PT or OT. I hope you learned something new today. Please go ahead and drop in the comments your aha moment or something that really stood out for you, something new that you learned. I want to thank you for watching. If you have any questions about what I talked about today, please feel free to message me or leave your questions in the comments. I will definitely come back and answer them. I will see you next time.